In terms of the medical risks, it's a complicated parameter of things depending on the person, but there are some very simple ways of keeping an eye on the medical risks of starvation syndrome. So if the temperature, blood pressure and heart rate are always done with an anorexic, when they come to see you, somebody with anorexia nervosa, as long as the temperature's in a normal range, the heart rate's between about 55 and about 85 and doesn't change on standing up, and the systolic blood pressure's around about 100 to 110, then in terms of the physical parameters, it doesn't need an urgent response. But if when they stand up, their heart rate becomes really fast, then their autonomic system isn't working properly, and that's a more serious sign. If they can't maintain their blood pressure when they stand up, then that's a serious sign. And it must be a standing, lying assessment, not a sitting, standing. And in terms of blood tests, if a full blood examination and kidney or renal function tests and magnesium, calcium and phosphate are done as a regular, then you can look out for signs of starvation, including suppression of the bone marrow, which you would see very serious drops in the white cell counts, and anemia that can become quite serious. You're also looking to see if their body's compensating for any food they're eating and moving into actually starvation syndrome, which is at a most basic level a problem of the cell's metabolism, and GPs can have there's very easy for them to see, okay, if the phosphate, calcium and magnesium go up too high or go too low, then they need to be supplemented and sometimes need to go to hospital. It's also a good measure of hydration. If they suddenly go from a low hemoglobin to a high one, it's always important to look at the concentration of the blood, because sometimes people with anorexia nervosa can get very, very dehydrated and surprisingly quickly. And the other cautionary note would be the rate of weight loss. If somebody's losing more than 1.5 kilos or 2 kilos a week, the body can't compensate.